On this episode, we'll talk about your thyroid, we'll talk about bruising after surgery, hot tubs, when to get in, and we'll talk about the use of straws. Hello everyone, and welcome to episode 15. Welcome to episode 15 of the Ask Dr. A show. Great to be back. We got good questions on this episode, and I know that will be very useful for all my gastric sleeve patients out there. So let's get into the show.
What do you recommend out TSH being at?
All right, I get a question regularly of people asking me, what is a good level of TSH, the thyroid hormone, or the T4, or the T3, etc. All right, here goes. It is important for you to understand that the sleeve is very independent from your thyroid. So your thyroid levels will be depending on everybody. It depends on everybody. They may vary on everybody. If you have thyroid issues before surgery, please follow up with your endocrinologist, because he or she will be the one to ask, what are my thyroid levels, what should they be, and what to do about it. Please separate your sleeve from your thyroid, totally independent.
I have a lot of bruises. Is it normal?
All right. Bruising after surgery, fairly common, but I would suggest you check your, get some blood work done. Number one, check your blood work, make sure there's no other thing causing the bruising, because directly related to the sleeve, it's not that common. So I would check your blood work, check with your PCP, make sure your blood levels are good, your platelet levels are good, your iron level is good, your hemoglobin level is good, etc. Stuff that your PCP will take care of and coach you. But directly to the sleeve, not that well related. I wouldn't worry that much regarding your sleeve. I would check first any other issue that may be related to these bruisings.
When can I go in a hot tub?
All right, so the answer to submerging underwater after surgery varies from practice to practice. In our practice, we recommend my patients not to submerge underwater like a bathtub or a swimming pool in the first 15 days. Avoid submerging underwater. Let the incisions heal naturally, and after 15 days, those are healed. You can submerge underwater like a bathtub or a swimming pool. Before 15 days, the last thing you want to worry about is a skin infection. So try to avoid submerging underwater.
Are we never going to be able to use a straw?
Very good question. The use of straws. Small straws. Well, straws are normally not recommended, but I tell my patients small straws like the ones used at with the small juices or the high C juices, those very small ones you can use right away. I wouldn't recommend using regular straws right away after surgery, because when you suck on the straw, a column of air first comes into your mouth and you're swallowing that air. That air will end up in your sleeve and may feel uncomfortable the first 3 months after surgery. After 3 months, your sleeve will be able to handle straws or the air in it, but the first 3 months I would avoid using straws initially. So that's it for episode 15 of the Ask Dr. A show. Don't forget to use the hashtag AskDrA. By the way, I want just to add a little bit extra on the question on the bruising. It is very important to avoid all these issues by taking vitamins. Take your vitamins, take your supplements is very important, all right? So the question of the day is, do you take your supplements? Do you take your vitamins? The answer, yes, no, down below. I want to hear from you because we're doing some statistics here. Yes, no, the answer down here. I'm looking forward to hearing from you. We'll see you on episode 16. I'm Dr. Alvarez for the Ask Dr. A show.